Today we are going to discuss about Black Death. Black Death, also known as the Bubonic Plague, was a devastating pandemic that swept through Europe in the 14th century. It is estimated to have killed between 75 and 200 million people, or up to 60% of Europe's population at the time. Black Death is passed into few countries. They are Europe, including Italy, France, Spain, England, Germany, and others, North Africa, including Egypt and Tunisia, the Middle East, including Syria and Iraq, Central Asia, including China and Mongolia, India. Russia. Evolution of Black Death. The Black Death is caused by the bacterium Yersinia pestis, which is primarily spread through fleas that live on rats. The disease spreads quickly and can be fatal within a matter of days. Symptoms of Black Death: fever, chills, headache, and swollen lymph nodes, buboes, which give the disease its name. The pandemic first appeared in Asia in the early 14th century and spread to Europe through trade routes. It reached Europe in 1347 and quickly spread across the continent, devastating cities and towns. The disease was so contagious and deadly that it caused panic and despair among the population, leading to social and economic disruption. The Black Death had a profound impact on European society, leading to significant changes in political, economic, and cultural structures. It also had long-term consequences, such as depopulation, the collapse of feudalism, and the emergence of a new middle class. Today, the Black Death is still considered a significant historical event and serves as a reminder of the devastating impact of pandemics on human societies. The Black Death, caused by the bacterium Yersinia pestis, is still present in some parts of the world today, particularly in rural areas of Africa, Asia, and South America. However, thanks to modern medicine and public health measures, the disease is no longer the global threat that it was during the 14th century pandemic. Here are some measures you can take to avoid contracting the Black Death. Number 1. Avoid contact with rodents. Rodents such as rats and mice are carriers of the Yersinia pestis bacteria that cause the Black Death. Avoid contact with rodents and their droppings as much as possible. Number 2. Keep your surroundings clean. Keep your living and work areas clean and tidy, free of clutter and debris. This will help eliminate potential rodent hiding places and breeding grounds. Number 3. Protect yourself from bites. Wear long-sleeved shirts and pants, and use insect repellent to avoid flea bites, which can also spread the disease. Number 4. Be careful when handling animals. If you work with animals, be sure to wear protective gear, such as gloves and masks, to avoid exposure to the bacteria. Number 5. Get vaccinated. There is no vaccine for the Black Death, but vaccines are available for some other diseases that can cause similar symptoms. Make sure you're up to date on your vaccinations to protect yourself from other infectious diseases. If you experience symptoms such as fever, chills, and swollen lymph nodes after possible exposure to the Black Death, seek medical attention immediately. Early treatment with antibiotics can greatly improve your chances of survival.